Breast surgery has become one of the most popular forms of cosmetic surgery, ranging from breast augmentation for enhancement to surgical reconstruction following breast cancer. The team at Holcomb Crathen Plastic Surgery offers it all. Dr. Joshua Crathen joins us now to talk more about this. Good to have you back, Doctor.
Thank you for having me.
So let's talk about what the general reason is for breast augmentation and why has that become so popular?
Well, I think for a variety of different reasons. I see many different types of patients, young, middle-aged, older, and I think really the trend I've seen is that most women want to feel and look their best. And so, for example, if someone is very fit and doesn't have much breast tissue, they want to look more natural and have a fuller breast. Another population I see is women after pregnancy, where things change and there's some drooping or loss of volume, and they just want to look like they did prior to their pregnancies.
And what's the most popular type of surgery that you're performing on the breast?
I'd say the most popular type is breast augmentation or enhancement.
And what are you using now for breast augmentation? I'm curious.
So there's two types of implants that are available, saline and silicone. I love both. The silicone implant, there were issues with it many years ago. It was redesigned and FDA approved approximately 10 years ago. And at this point, I would say about 80% of my patients are choosing silicone and about 20% saline.
Interesting. What about male breast surgery? What are they getting done?
I have a lot of male patients, and the most common reason for them to come see me is because of something called gynecomastia, where there's actually extra breast tissue or fatty tissue. So I'm doing a lot of laser liposuction patients for male breast reduction.
I'm thinking that the recovery when you're using a laser, is that less time?
It's fairly quick. It's just a week or two. There's some swelling and bruising. The results are excellent.
Explain a little bit more about the breast reduction technique. How do you do that? Like, how does that work?
Well, and most of my patients are female for breast reduction, and so if someone has back pain and neck pain and their breasts are extremely large.
They've got ridges in their shoulders.
Exactly.
And
And
the bra
often
is so heavy.
Often that's a procedure that's covered by insurance. So I have some specialized procedures where I'm reducing the breast tissue, reshaping the breast, and lifting it.
That's pretty major, though, a surgery, is it not?
It is. It's about 3 hours, and it's something that often the patients are very happy with afterwards.
What about helping women who are recovering from a mastectomy?
So I have many breast cancer patients. Unfortunately, about 1 in 8 women develop breast cancer in their lifetime. October is here, and it's Breast Cancer Awareness Month. And so I have a lot of expertise in breast reconstruction. Prior to doing plastic surgery, I did general surgery and have done a lot of breast cancer procedures. And so primarily the method I use is what's called a tissue expander. So after the breast is removed, I place an expander, and then over a period of months, it's expanded.
So that's to stretch the skin a little bit?
Stretch the skin out, exactly.
Okay.
And then I exchange that usually for a silicone implant after a few months.
Do you feel your particular approach to breast surgery is unique, and how?
Well, I'm very humble, but I'm very good at what I do. And so I'm an artist, I'm a painter, and I love to use my creativity and technical skills to help my patients achieve their goals.
All right. Well, thank you very much for coming in and telling us about it. To schedule your consultation at Holcomb Crathen Plastic Surgery, do so today by going to sarasota-med.com, or you can go to tampa-med.com. Doctor, thank you again.
Thank you so much for having me.
We'll be right back.